Katherine Kennet. I am a psychiatry registrar in CAM Psychiatry, so Child and Adolescent Psychiatry. I work in North London at the Tavistock Clinic, and this video is about antidepressant medication. It is a very brief overview, but hopefully it will be helpful and give you a structure to your revision. Antidepressants and antipsychotics are really common questions to be asked in written exams, so hopefully you'll get your knowledge up to scratch and it will feel easy in the exam. They're also really good. I like these medications. I find them very useful. So, antidepressants. These are my crib sheets. I hope that that's legible. So, antidepressants, the way of thinking about it is SSRIs, selective serotonin reuptake inhibitors, and others. So SSRIs work really, really well. They're all quite similar in terms of their side effect profile and what they are good at. I've got a little way of understanding the personalities, as I call them, of each medication that I will talk you through, but essentially they work really, really well. They're really, really safe. Most people find they're quite helpful. The guidance, if you try one, give it a good trial. So I would say 2 or 3 months, a good going dose. If that doesn't work, chop and change to another one. Again, a good trial. If that doesn't work, then you can try a non-SSRI medication. The SSRIs don't just work on serotonin, but they basically do mainly. They, as I say, are very safe. All medications that affect the brain have a small risk of serotonin syndrome or neuroleptic malignant syndrome. Look those up. Exam questions love them. It's really, really rare. But I always tell my patients that there is a very small chance of this very serious side effect. If they feel very unwell, they should go to hospital as they would normally, and they can be treated there. The treatment for that is supportive, so it's really important they get to hospital. So they work really well, they're nice and safe. Side effects, I'd look them up, I'm not going to list them all now. They tend to take 2 weeks to have any effect. 4 to 6 weeks to have the full effect, really. Well, 4 to 6 weeks to work and 6 weeks to have the full effect. You start low, you increase slowly. People often have some side effects as their body gets used to it, I guess, in the first 5 to 7 days. If those side effects don't go away in 5 to 7 days, I tell my patients to tell me. No one should ever stop taking SSRIs suddenly, because you get what's called the serotonin, the SSRI withdrawal syndrome. It's not going to hurt you, it's not dangerous, but it can cause electric shock symptoms or sensations. You can feel quite sick, generally flu-like symptoms. As I say, it's not bad for patients in terms of it's not dangerous, but it can make them feel pretty rotten for 5 to 7 days after stopping. If someone misses more than 2 days worth of doses, you take SSRIs in the morning. If they miss 2 mornings worth, then it's assumed that they've stopped taking it and have to be retitrated because of the effect on the blood.